In today's video, I'm going to be going over the 3 signs that you're suffering from a disc herniation and how to fix it. Welcome back to the channel. If you're new here, my name is Todd Sullivan. I'm a chiropractor who specializes in treating chronic pain and sports injuries. One common condition I treat in my office are disc herniations. There's 3 clear signs that you're suffering from a disc herniation. The first sign that you're suffering from a disc herniation is if you cough or sneeze or have a bowel movement, that causes a sharp pain in your lower back and sometimes will also cause the pain to radiate down your leg. That's a sign that you're suffering from a disc herniation because when we cough or sneeze or have a bowel movement, we're increasing the pressure inside of our disc. And if that disc is herniated, that's going to put more pressure on the nerve and cause sharp pain in your back or down your leg. The second sign that you're suffering from a disc herniation is if you sit for a long period of time, it's difficult for you to get out of a chair and it causes a lot of lower back pain and it's difficult for you to become upright. Sometimes patients will also feel like they're crooked after they've been sitting for a while. And what that means is if you look down and your belly button is towards one side, that's your body's way of trying to take the pressure off the disc, and that's a sign that you're suffering from a disc herniation. The third sign that you're suffering from a disc herniation is when you're sitting, if you bring your head forward and or you extend one of your legs, that causes a sharp pain in your lower back or causes the pain to radiate down that leg. That's an orthopedic test that we do because it pulls on the nerve. If that disc is herniated, that's going to put more pressure along that disc and along the nerve, and it's going to cause pain and discomfort either in the lower back pain or cause the pain to radiate down your leg. And that's a sign that you're suffering from a disc herniation. If you suffer from any of those 3 signs, here's how to fix it. The first thing we're going to do is what we call a lumbar extension exercise. So what it's going to look like is we're going to go onto our stomach here, and we're going to use our hands to press up into a lumbar extension. And what you should feel is this should relieve some of the pressure that's radiating down your leg and causing you sharp lower back pain. And if it increases your symptoms, this could be a sign that you're suffering from a different type of disc herniation, and I want you to discontinue that exercise. But what we want to do is you want to push up into lumbar extension. What that's going to do, it's going to force the disc herniation back into that disc and take pressure off the nerves. And what you want to do is you want to hold that for 8 to 10 seconds and then relax down. And then we want to perform that again. Hold that for 8 to 10 seconds and then relax down. What I like to have patients do is to do this 3 to 5 times and do this twice per day. And again, you may feel some discomfort, but we don't want it to be a sharp pain that radiates down your legs. That's a sign that this is not the correct exercise for you. This is a great exercise to perform if you're suffering from a disc herniation. So lumbar extensions are the first exercise I'm going to recommend you do if you're suffering from a disc herniation. The second exercise we want to perform is going to help stretch out the hips and help take pressure off your hip and lower back. And that's going to take some pressure off that disc and improve your mobility. So this exercise is called the 90-90 position. So what it's going to look like is our front leg is going to come forward and we're going to have a 90-degree angle with our knee and our shin here. Then the trailing leg, we're going to put it at a 90-degree angle as well. And what we're going to do is we're going to support our upper body with our hands out to our side, and all we're going to do is keeping our back nice and straight, we're going to lean forward, and you should feel a good stretch in your hip and into your lower back. And you want to hold that for 5 seconds and then come back up. Perform that again, hold for 5 seconds and come back up. When performing this exercise, we want to keep our spine nice and straight. So if you start to round your spine, that means you're going too far and you don't have the mobility to get that position. So I want you to take it as far as you feel comfortable, and you should feel a good stretch in your hips, and this will help to improve your mobility and take pressure off your lower back, which will help fix your disc herniation. The 90-90 position from your side is going to look like this: 90-degree angle with that leg out in front, and then a 90-degree angle with the trailing leg. This is going to be stretching my left side and improving my mobility. So again, back nice and straight, and then you're going to lean into it, and then you're going to feel a nice pull into your hip and help take pressure off your hip and improve your mobility, which is going to help fix your disc herniation. And again, we want to hold this for 5 seconds, good posture, come back up, go down, and then come back up. Perform the 90-90 stretch on both sides and perform this twice per day. This will really help to improve your mobility and take pressure off your disc in your lower back. The third exercise I want you to perform if you're suffering from a disc herniation is a modified bird dog exercise. This exercise is going to help to stabilize your spine and strengthen the muscles around your core, which is going to help take pressure off the disc in the lower back. To perform this exercise, what we're gonna do is we're gonna bring our arms underneath our shoulders. We're gonna get up onto our toes, and what we're gonna do is we're gonna extend one leg out, hold for a few seconds, and come back in. Then we're gonna go opposite, hold for a few seconds, and then come back in. And while performing this exercise, we wanna draw our belly button towards our spine, which will activate our core, and that'll help to strengthen our core and strengthen our glutes and take pressure off your lower back. When performing this exercise, you wanna do 10 repetitions, hold each repetition for 2 seconds, and come back. You wanna do 2 sets of this, 20 repetitions total, and you wanna perform this once per day. This is a really great core strengthening exercise, and it really helps to take pressure off your lower back and to help heal your disc herniation. So those are 3 signs you're suffering from a disc herniation and how to fix it. If you have any questions, reach out to me at 703-912-7822, or you can schedule online at novacarewellness.com. And if you want to learn 7 exercises to decrease lower back pain and improve your posture, click this video right here.